I think I was talking about the economic benefits of controlling pain. No, the economic ramifications of poor pain control. Yeah. So, disability, loss of income, loss of insurance, increased medical bills, financial devastation, impact on the healthcare system, increased length of stay, increased chance of complications if you go back to the physical ramifications. Just horrendous costs to everybody involved. There's also legal and regulatory concerns. These days, JCAHO is really on our back about documenting, doing our pain assessments and documenting them properly and reassessing pain afterwards. So, and that's not to punish the nurses and the doctors. That is with the patient's best interest in mind. There's always legal ramifications too, because these days patients can sue you if you don't control your pain, and if you develop if they develop complications as a result of that poorly controlled pain. And now that JCAHO is putting so much focus on it, I imagine that patients are going to be paying more attention to it too. So they're going to think, oh, well, yeah, they didn't do their job, so I'm going to sue. So basically, the goal, the benefits of pain control are that none of what I just said will happen, and also patient satisfaction. Finally, and ooh, you're like, thank goodness she's done, addiction. And I promise not to stay on this one too long. Oh, I lost my little page with the definitions on it. Okay, addiction is defined by the American Pain Society as a pattern of compulsive drug use characterized by a continuous craving for an opioid and the need to use opioids for effects other than pain relief. Addiction has one or more of the following components: impaired control over the drug use, compulsive drug use, continued use despite harm, and cravings. And addiction would be, you know, this is why people come within a hair of death on heroin or whatever, or opioids or whatever the drug of choice is, and yet as soon as we get them back and they're out on the street again, they're doing drugs. That's an addiction. Although it can have components of physical dependence and tolerance, they're not the same thing. With addictions, we tend to undertreat this population, there are a lot of healthcare workers out there that see that the person has a history of addiction, and they may have biases towards them because of that. Well, they shouldn't be doing those drugs, and if they didn't, they would be in this situation. So that might be true, but that's not what the main concern is, especially post-operatively. We've got to get their pain under control. And they tend to be an undertreated population, partly because of that. Also, they tend to, a lot, like some healthcare workers are afraid to give them a whole lot of drugs, especially if they're in recovery, because they're afraid that they might kick them back into their addictive behavior again. And patients are afraid of that too sometimes. And a lot of patients are afraid of becoming addicted. On the other hand, if we don't treat the pain appropriately, that can be a factor that can cause the person to go back into using drugs again. So we need to be aware of that. They should not have their medications reduced or interrupted at that point in time, because they're going to be having more pain than normal. Chronic painers can be addicted to their pain medication also. Pseudo-addiction, this is not really something that I thought about until I started preparing for this speech, but pseudo-addiction encompasses the clock-watching behavior and hoarding of medications and going to different pharmacies and acting very agitated if the medication's not available. And it's all based upon a fear that their pain is going to get out of control if it's not given on time, or that they might run out of the medication. So That's the basis. It's not necessarily a real addiction. Physical dependence is a physiological phenomenon that should be expected by persons who persistently use opioids, whether they're addicted or they just have tolerance or have been on it for a long time. Withdrawal can occur when the drug is abruptly stopped, and also severe pain can go along with this. Tolerance, finally, my last slide, hey! Tolerance builds up is a process that is adaptive. It takes place over time as the person is exposed to the drug. And over time, one or all of the drug's effects are minimized. Thank you very much. Any questions? And believe it or not, I will be more relaxed in the question and answer section of this than I am giving the speech. Okay.